What's up, guys? Back at it here with another episode documenting my MCL and hamstring injury and recovery. Today, I wanted to go a little bit more in depth on range of motion. Range of motion and regaining range of motion specifically is one of the first steps and one of the most important steps that you want to make sure you take early on in your rehab process. To really get back to where you are getting to or as close to full range of motion in the injured joint that you can, in order to move on to the next stages of rehabilitation and corrective exercise. It's really kind of one of the foundational building blocks that you want to focus on early on, and that's what we're going to focus on today. So let's get started. So a lot of times with a joint injury, you will have reduced range of motion, not only in the injured joint itself, but also in the surrounding joints above and below the injury. In this case, obviously my knee is going to have limited range of motion, but also my ankle and my hip flexors will have been affected due to this injury. The reason for that, a lot of times, obviously, when you have an injury like this, you need to either immobilize it if you were in a cast, or in this case, I was braced with limited range of motion for a little while in the early stages of my recovery. Your body tends to compensate with those limited range of motions by relying on the good limb or the other side in this case. So my right leg was taking the majority of the load during those times when I was favoring the left side. So when you do that and when you hold it immobilized, a lot of those muscular structures and connective tissue get tight and limited range of motion because of that immobilization. So one of the first things you want to try and do is regain back your normal range of motion like we talked about. So what I'm going to do is show you two different modalities to do that. The first is going to be kind of a active mobility exercise where we're doing everything unloaded, but it's just real light and just kind of working through the range of motion. And then the second is going to be some static stretching to try and help our ankle and hip flexor mobility. So let's jump into it. So this first exercise is focused on regaining mobility knee extension. So the setup for this is to have your foot elevated on a block or a stool and really just let gravity do the work here. You don't want to put pressure on your knee to hyperextend or put any kind of excessive force on your ACL or other areas that might be inflamed due to your MCL injury. So we just want a slight flexion up, and then you kind of just let gravity pull that down into full extension to where you can almost feel the back of your leg touching the floor. To really get that good lockout, and you'll definitely feel the tightness, especially early on in the injury, in regaining this range of motion. So sets and reps here, you kind of want to feel this out at first. Obviously, at the beginning, it's going to be extremely tight on your medial side, and it's going to potentially cause a little bit of pain. So you kind of want to tread lightly there until you can start to work that more comfortably. But 10 to 15 reps, a couple sets, and then just kind of build up from there. So again, just kind of flex that knee a little bit and then let gravity come down to get that full extension. So the second portion of our mobility work is working on the opposition of what we just worked on. So instead of knee extension, we now want to try and work on knee flexion. With an MCL, you're also going to have limited ranges of motion and knee flexion just because of the anterior fibers are stretched during knee flexion as opposed to the posterior fibers being stretched during extension. So not necessarily as limited as an ACL or some other knee injuries. So a lot of times you will be able to get both flexion and extension back a little bit more quickly with an MCL than you would some of the other ligaments in your knee. But for this exercise, it's called a heel slide. So basically we're doing just that. We're using our hamstring, keeping good upright posture, and just use that hamstring to pull your knee in towards your butt. So At first for me, because of the hamstring injury, this was very difficult to do. So if you do need to modify the exercise, you can use a band for that and use that band to assist your hamstring to pull that knee in to really get that good flexion. Push back out, pull in. So that's a heel slide. So the next exercise we're going to work on is regaining our range of motion, specifically dorsiflexion, which is pulling your toes in towards your shin bone in your ankle. So a lot of times with a knee injury, like I said, we'll also have limited range of motion in our ankle because of the time spent immobilized. So this exercise here is basically a angle block calf stretch. Specifically, this is focusing on your gastrocnemius, which is the bigger muscle in your calf. So kind of just set this one up, have an angle block to get your forefoot elevated, and then get yourself stabilized and just keep your legs straight and lean into that stretch. So you'll feel this definitely up the back side of your leg and your lower leg for sure. And that's it. That's the calf stretch. Hold for 30-40 seconds, get a good static stretch in there. Make sure you're breathing, make sure you're calm, trying to relax, especially on the exhale of the breath. And this is your angle block calf stretch. So the next static stretch exercise that I want to show you guys is focusing on lengthening your hip flexors. So a lot of times in general, people just have tight hip flexors just from all the time we spend these days sitting down in a 90-degree flex position, whether it's chairs, cars, you name it. We spend too much time sitting these days. So a lot of people have tight hip flexors to begin with, and then you add an injury to that, and the problem only gets worse. So this is a really good stretch to open up those hip flexors. This specifically targets the psoas, which is a very tight component of your hip flexors in a lot of cases, and this is a great way to do that. So we want our rear foot elevated here. This is also continuing to work on our knee flexion, which is something that is always nice when you can double up stretches at the same time. This one, obviously, you want to make sure that you don't have any pain, so keep things padded up. You may want to wait a few weeks if your injury is fresh, because obviously you are weighting your knee a little bit with this one. So kind of use pain as your guide on that one. And obviously make sure if you need to modify this, you can certainly do that just with dropping your knee down to not add the knee flexion to it as well. So we want to get in this position, rear foot elevated to the stretched leg, and then we just want to keep our upper body straight, and you want to drive your hips forward. So you're going to feel this all the way down the front of your hip flexor, and then you're going to feel quadricep stretch in here as well because of the knee flexion. So this is a really good stretch. Again, hold these for 30, 45, even 60 seconds. Like I said, a lot of people's hip flexors are tight, so definitely don't be afraid to hold this one for a while. All right, so those are the exercises that I have for you guys this week. Obviously, there are a ton more stretching and mobilization exercises that you can be doing and should be doing if you're rehabbing a knee injury. But given the attention span of most people these days, if you guys are even still watching this video after the 5 or 6 minutes that we're into it at this point, you're doing better than most people. So I want to try and keep these short and to the point, and we can only go from here. So the next video that I want to do next week is really going to start to focus on strengthening. So me personally, I'm doing pretty well with my recovery. This thing's coming along real nice. I'm happy with the progress that I've made over the past month or so. And I'm really ready to get back into it and start getting some strength in this thing and get me back to where I want to be. So stay tuned for next week, and we'll see you then.